Thank you for joining us for another topic in our heart failure series. Today's topic is heart failure medications. Let's take just a few seconds to review what is heart failure. Heart failure means the heart is not able to pump sufficient blood to meet the demands of the body. It doesn't mean that the heart has stopped working or is beyond repair. Many treatments are available to help patients live longer and feel better. Heart failure can be treated but not cured. Benefits of heart failure medication. They slow the progression of heart failure and help people live longer and feel better. They reduce the frequency of ER visits and heart failure-related hospitalization. And they reduce the workload on the heart. Medications for heart failure belong in several different classes or families. Each group affects the heart in a different way, and you may need one from each group. It is important to understand how they work and what the potential side effects are. Let's have a look at them. Beta blockers. Some medications in this class are bisoprolol, carvedilol, and metoprolol. How do beta blockers work? They work by blocking the stress hormone adrenaline, which can lower the blood pressure and heart rate, decreasing the workload on the heart. It also enhances the heart's ability to relax. Some possible side effects would be dizziness, fatigue, a slow heart rate, maybe some worsening of some pre-existing depression symptoms, headache, and to use in caution for diabetes and asthma. ACE inhibitors and ARBs. Medications in the class of ACE inhibitors include, but are not limited to, enalapril, perindopril, and ramipril. Medications in the ARB class include, but are not limited to, candesartan, valsartan, and irbesartan. How do ACE inhibitors and ARBs work? They work to dilate or relax or open up the blood vessels, and this can reduce the blood pressure and improve blood flow. They decrease the workload on the heart or the stress on the heart. They reduce the heart failure symptoms and slow the progression of heart failure. They also prevent kidney damage in patients with diabetes. And when used in combination with other heart failure medications, ACE and ARBs can reduce symptoms of shortness of breath, edema or swelling in the ankles, and increase energy. Some possible side effects: dizziness, persistent coughing that's related to the ACE inhibitor, and possibly some changes in taste. Aldosterone antagonists. Some of the medications in this class include spironolactone and amplironol. How do these medications work? Well, they block the hormone aldosterone that controls the amount of fluid, potassium, and water in the body. They are also a diuretic, so they make your kidneys get rid of extra fluid, lowering blood pressure and decreasing the workload on the heart. They also block the sodium and water reabsorption and retain a key electrolyte, potassium, in the body. Possible side effects: increased urination, fatigue, increase in potassium levels, breast tenderness in men, and stomach cramps, possibly related to some diarrhea or nausea. Sacubitril valsartan. The only medication in this class actually is sacubitril valsartan, also known as Entresto. It's important to note that if you are prescribed Entresto, one of your other medications would be stopped. So the medication from the ACE inhibitor ARB class will be stopped. How does Entresto work? Well, it works to block the effects of harmful hormones that cause blood vessels to constrict and hold on to salt and water. It also prevents the breakdown of beneficial hormones that cause the blood vessels to relax, allowing the body to get rid of extra salt and water. These two effects together help to decrease the strain on a weakened heart muscle. Possible side effects: lightheadedness or dizziness, dry cough, increased potassium levels, being tired or weak, nausea, or some upset stomach. Ivabradine. The only medication in this class is ivabradine or Lancora. How does Lancora work? Well, it works by slowing the heart rate. It has no other effects on the heart or the blood vessels. It acts only on the sinus node, which is the body's own natural pacemaker. The sinus node sets the heart rate. It is only used in some patients who have a resting heart rate of 70 beats per minute or faster. Possible side effects: lightheadedness or dizziness, feeling tired or weak, maybe some vision problems, seeing flashes of lights or halos. SGLT2 inhibitors. Medications in this class include empagliflozin, canagliflozin, and apagliflozin. These medications were primarily prescribed for diabetics, but recent research has found that they can be used in patients with mild to moderate heart failure due to reduced left ventricular ejection fraction of maybe 40% or less. And they're effective for patients with or without diabetes. They help improve heart failure symptoms, quality of life, and also reduce the risk of hospitalizations. These medications increase the amount of sodium or sugar that is passed in the urine. This can help improve the A1C levels, also help maybe lower our blood pressure levels as well, and the overall improvement of urine output or decreased volume in our body. Possible side effects may increase the risk of urinary tract infections, possibly some yeast infections, the risk of a low blood pressure, maybe acute kidney injury, and diabetic ketoacidosis is also a risk. Diuretics. Medications in this class include, but are not limited to, furosemide, metolazone, and hydrochlorothiazide. Diuretics, which are commonly called water pills, are very useful for reducing excess water in the body. People with heart failure have a tendency to retain the fluid. Fluid can accumulate in the ankles, the legs, the belly, and maybe even up around the lungs, and all this makes it difficult to breathe and feel extremely fatigued. How do diuretics work? Well, they stimulate the kidneys to produce more urine, and this helps the kidneys get rid of excess water and salt from the body. It also helps to decrease the workload on the heart. Less water in the body, less work for the heart to do. Possible side effects: frequent bathroom trips, dehydration, muscle cramps, constipation, gout, and possibly thirst. Medication safety. It's important to take your medications as prescribed. Call your healthcare provider if you're experiencing worrisome symptoms. Don't stop taking your medications. If your blood pressure is low, avoid very hot environments like hot showers, baths. Certainly avoid hot tubs and saunas. And avoid strenuous activity in weather temperatures greater than 30 degrees Celsius, which includes the humidex. Schedule a meds check appointment with your pharmacist so you can review your over-the-counter medications, your supplements. And also, it's important to avoid the NSAIDs, medications such as Aleve, Advil, Motrin. These medications can worsen heart failure symptoms and contribute to fluid retention. And ensure routine blood work. Some of the medications you're taking might retain some of your key electrolytes like potassium. So it's important to have a proper level to looking at your electrolytes as well as your kidney function. Let's finish up by looking at the self-management and treatment of heart failure. Important to monitor and track your daily morning weight. This is a good indicator if your body's holding on to fluid or not. Monitor your diet. Look at your fluid and your sodium intake. Follow the heart failure zones. Get regular physical activity and exercise. And take your medications as prescribed. Your weight log and the heart failure zone guide can be found at www.gethearthealthy.ca/heart-failure. What is one thing you learned from this presentation? You might say, you learned the heart is a pump. In heart failure, the heart is unable to meet the blood or fuel demands of the body. You may say you learned each class of medications affects the heart in different ways, and you may benefit from one from each of the group or classes of heart failure medications. Or you may say, many medications have been shown to help people with heart failure live longer, feel better, and reduce the frequency of ER visits and heart failure-related hospitalizations. For more information, speak with your exercise therapist or visit the Living Well with Heart Failure section on our regional website. And remember, you can always speak with your doctor or pharmacist with any of your medication concerns.
Thank you.